I'm Stephen Mcculley. I'm a consultant reconstructive and aesthetic surgeon, and I'd like to talk to you a little bit about facelift surgery. Obviously the main aim of facelifts is to create more youthfulness, more freshness back in the face, and the main concerns that patients have usually revolve around the jowl area and the neck area. There's different ways of doing the operation. The full facelift involves a scar from the hair in front of the ear, then up behind the ear and along the posterior hairline. A full facelift is very good at not only addressing the jowl, but is particularly good at also addressing the neck. By contrast, the short scar facelift, which has a scar running from the hairline and in just in front of the ear down to the earlobe, occasionally the scar goes in front of the sideburn hair. The short scar facelift is still very good at doing the jowl, reasonable at doing the neck, but not as good on the whole as giving neck tightness of the full facelift. Which is more suitable for you? Well, that would need to be discussed with you when you came to see me or your local reputable surgeon, and there's pros and cons to each. The short scar facelift has less scars, it has slightly less dissection inside underneath the skin, and therefore it has slightly lower complication risk and a quicker recovery. So there are real advantages to that. And when the main problem is here and a little bit in the neck, I would usually perform a short scar facelift. However, when the neck is really hanging or there's a lot of extra skin, then that is less suitable, and then I would definitely advise a full facelift. The operation has similar principles. Essentially the skin is peeled away and it's dissected away to a certain degree, and that's variable depending on the requirements. And then underneath, the muscle layer is tightened to try and really pull particularly the jowl and particularly the neck area. That's an important part of the operation. It's called the SMAS. That's just a posh medical term for this muscle layer underneath the skin. The skin is then re-draped back up, leaving you initially looking a little bit tight, but that will relax after a week or so. It's very important we don't try and create too much tightness, because that can just cause complications and also an unnatural look. This is very much a routine operation. In my hands it takes anything between 2 to 4 hours depending on the type of operation. There aren't a lot of risks, but those risks do include bleeding, infection, wound healing problems, slight lumpiness under the skin, and that can be from a little bit of fluid collection, or actually is quite common just from the tightening of the muscle layer initially, and that settles out. Very uncommon but much more serious are injuries to the nerves that move the muscles of the face, and that can give a temporary weakness to the corner of the mouth or the brow, but it's important to emphasise that that is uncommon. The operation involves usually a one-night hospital stay. You'd be dressed up in a bandage, you'd have some small drains which get removed the following day, and would help then clean you up, wash your hair, and you'd go home the following day, although looking a little bit bruised and a little bit swollen, just with a much smaller head bandage on, which you'll use during the night, particularly for the first week to 10 days. You'll come back after approximately a week, sometimes a bit less, to have the stitches removed from the front of the ear and up behind the ear if you have those, and you have some staples in the hair which also get removed at that time. Overall, the recovery from this physically is not too bad, and in fact you'd be up and about almost straight away, but social downtime in terms of bruising and swelling is a minimum of 2 weeks, and really 3 weeks to let all the bruising and swelling settle. Saying that, you're still not going to get your final result for anything up to 6 to 8 weeks, and even very occasionally even longer for it to really truly settle down. The scars tend to heal very well, and they're usually long-term, almost very difficult to see, but it can take a good few months for those scars to fully settle, and up for a year for them to truly turn white and become very thin. Overall, this is a good operation. It won't last forever, but we can certainly create some really good freshness to the face, and the decision as to what type of technique I would discuss with you at a consultation. So whether you're going to come and see myself or another reputable surgeon near you, I wish you well with your facelift surgery.